In Philadelphia, leaders reverse course, dropping the city's mask mandate days after reinstating it. Lots of back and forth to talk about here. When it comes to COVID, let's bring in our medical expert, Dr. David Winter from Baylor Scott White Health. It is good to see you, Dr. Winter. So first up, mask or no mask? I flew this weekend, actually just as recently as last night. But so that's the question. People are kind of going either way, depending on how they feel.
Well, first, let me emphasize, Sonia, that it's been clearly shown through good scientific studies that if you have a disease or malady in the air, transmitted through the air, I'm talking about COVID, influenza, the common cold, even allergies, if they're out there and you wear a well-fitted mask, you have much less chance of getting those conditions. Now, should you wear one or not? I got 4 reasons you might want to consider it. First, if your own health is such that if you do get COVID, you're likely to get seriously ill, or your loved ones are very vulnerable to that, you might want to get that so you don't transmit it to them. Number 2, if you're going on a big trip, or if you've got graduation coming up, or some big event like a wedding, you might want to consider wearing a mask before that so you don't get sick and miss that. Number 3, if you don't want to be harassed or even ticketed in areas where you are required to wear a mask. And number 4, if you're unvaccinated and going to an area where there's a high risk of transmission right now of COVID, you might want to consider it. It ultimately comes down to personal choice, hopefully mixed in with a little common sense, Sonia.
Dr. Winter, Moderna has a new vaccine on the horizon. If someone is eligible to receive a vaccine, should they wait for this one, get what's available now? Does it matter if it's the booster or the original? What do you say?
Yeah, the Moderna folks say they've got one that they think is better than the ones that's out right now. We don't have hard data about that. Pfizer's got one on the way also. So I think we could best say there's no strong evidence to wait. And I would also point out the vaccines currently available work very well to prevent severe infections, severe illnesses, and folks that get them right now. So we got good things out there right now. I wouldn't wait if you need one.
Dr. Winter, in other health news, new and unusual cases of hepatitis are being reported. So what do we know about this?
Yeah, this just came out. There are 9 cases in kids in Alabama, ages 1 through 6, where 3 of them actually are showing signs of liver failure. So serious stuff. This is linked to adenovirus. Now, there are other studies in England and also other countries around the globe that are saying the same thing. This is new. Adenoviruses usually cause a common cold. But I think the message here, if your child is under age 10, they have a sore throat, scratchy throat, a little congestion, maybe a little fever, some aches, and they start to get real sleepy, real fatigued, and get that yellow-orange jaundice, then you need to call your pediatrician right away.
And finally, a new study from the University of California reports that a light workout, even just for 10 minutes, can improve your memory. You know I'm a big fan of this stuff, but can you explain to us why and how these two things are connected?
Yeah, that's a very promising study. It was published in the Academy of Sciences, so it's a good, well-known journal. Here's what they did. They took folks, they exercised and then did a high-resolution MRI scan, showed increased brain activity in a certain part of the brain called the hippocampus. Now, the hippocampus is where memory lodges right there. So the idea is that if this works well, then it might be able to help us have trouble remembering names, or even better still, might slow or maybe stave off Alzheimer's, dementia. We don't know exactly what the mechanism here, but they say it's 10 minutes of walking, stationary bike, yoga, tai chi, little simple things we could do to help stimulate that part of our brain to help with memory.
Okay, maybe that's why I have such a good memory, Dr. Winter. I'm just kidding. Thank you for your time today.
Good to see you.
You too.
Thank you.